Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. This one focuses on food allergies and the challenges some people have, especially with finding the right foods. And also, we look at new treatments. Right now, our team is working hard behind the scenes to bring you more amazing stories when our live programming returns in September. If there is an urgent update from the health system, we will be sure to let you know first. Until then, please enjoy this encore presentation and make it a great day. Coming up today, easing the burden of food allergies, where patients often pay more just to fill their grocery cart. Meet a mom whose fight for her own daughters turned into a $1 million idea that's helping other families. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Life with a food allergy means finding and eating safe meals, which, as it turns out, is easier said than done. And once you do find safe food, get ready for some sticker shock. It gets expensive and pretty fast. When Emily Brown looked for help feeding her two daughters, there really wasn't much help to be found.
And then we went to a local food pantry, and the only thing that was safe in the pantry was 2 potatoes and a jar of salsa. So, the foods were not available in the federal nutrition programs, and then they weren't available in the charitable side. And so that's when I really realized we needed to do something.
That was Emily speaking to us back in 2017 after she launched what's called the Food Equality Initiative. She created a safe food pantry that helps fill the gap for families facing the same lack of access that she did. And since then, Emily's idea has really taken off. Her advocacy has turned into entrepreneurship. Today, we are learning more about her effort to put food directly on the doorstep of families in need. We'll also meet an allergy specialist who is helping train others to start thinking about food as medicine. We are here with Emily Brown today, the CEO and co-founder of Attain Health. She advocates for equity in food allergy on the local and even on the national level. And she is also an advisor to the National Institute of Allergy and Infectious Disease. Good to see you.
Thank you for having me.
Yes, thank you. Really anxious to hear more about this. And we also are joined by Dr. Marissa Love, an allergist and immunologist here at the University of Kansas Health System. Dr. Love also helped put it out as she's also a medical advisor for Emily's first nonprofit, the Food Equality Initiative that we had mentioned. Good to see you as always.
Good morning.
So this is an issue that if you have never had dealt with it before, you might not really appreciate how much of a daily struggle this can be. We all have to eat, but when you have a food allergy, you have to make sure that what you eat also does not hurt you and make you sick. Emily, take us back. So your daughters were born in 2012 and 2014. How did you learn that they had food allergies?
Back then, the guidelines to introduce allergens in the diet for babies were very different than what they are today. And so I waited to introduce peanut butter for the first time for my oldest till after she had turned 1. And it was pretty immediate when we made the first introduction. Within minutes of her consuming the food, she developed hives, there was swelling, and it was pretty quick. I was very overwhelmed. I had some feeling or some familiarity with allergies. I had taught preschool, and I was aware of kids that had food allergies in my class, but for it to show up in my home, I was told others it was terrifying. And so once we got over that immediate reaction, we went to our physician, and at first we only saw our pediatrician. They did testing, and she was allergic to milk, eggs, wheat, soy, peanuts, and tree nuts. And as you can imagine, it was just an overwhelming and had a significant impact on our quality of life.
Yeah, milk and peanut butter out to get you. It's not something you think of as a new mom. And some of these basic items that people have around the house, and now you're having to deal with it on a health issue. Was that the most severe reaction she had with these hives? And
that was not the most severe reaction that she's had. We have experienced anaphylaxis. We've had to go to the ER. And so I think what's challenging about food allergy is, it's a condition that on a daily basis, you don't seem like you're sick. It's not visible. And so much of the labor and the work that it takes to keep that family member safe and healthy really is is invisible. And so it really means, having the right food at the right time, being aware of what is in your food, recognizing the signs of an allergic reaction and anaphylaxis, and being prepared and always having your medication on hand.
And as we said, if you haven't dealt with that, you just don't realize how this affects your daily life and how important it is. So tell us about the struggle just to feed your family. What was that like?
I mean, it was very challenging. I look back on those days and I'm kind of like, how do we survive? It was, allergen-friendly food costs 2 to 4 times that of foods that don't contain allergens, and it's really expensive. And so, just an average cost of a gallon of milk here in Kansas City was roughly, $4. But if you need to have an alternative, you could be paying anywhere from $6 to $12. I mean, at one point, the only bread that my daughter could eat was $12 a loaf.
Ridiculous.
Which is really just not sustainable for anyone.
What was it like when you would go into these food pantries? You mentioned salsa and what else was it that you said, a potato or something?
Yeah, 2 potatoes and a jar of salsa. I think people just assume that when you go to a pantry or you're entering the charitable food system that these foods will be there. And it's really not. Food pantries and food banks are dependent upon donations, and when we see the list of what's commonly asked for at donation, it's things like peanut butter and cereal and all these things that contain common allergens. So then individuals that have food allergies really are in a very difficult place. They're not able to get what they need from the charitable food system, and then the federal nutrition programs, while they have made some accommodations, they are limited. So families really are in a very vulnerable position.
Has that changed, though? Are we starting to see more of those items on pantries when you send out lists and people say, how can I help fill the shelves? Are some of those items starting to change?
I do think so. I think, definitely since the pandemic and just kind of hunger has become more visible in communities, and I think food banks and food pantries are also recognizing that it is not just their job to fill bellies, but to be mindful of the type of food that they're distributing. So we are starting to see more choice at food pantries, and a recognition that food is part of health and to be mindful of what we're distributing. So I think we have seen that. But it is still very limited. And when we think about the organizations that are specifically procuring allergy-friendly foods, they're very few and far between across the nation. So it is really a fragmented system, and it's wholly dependent upon donations, charitable gifts.
Such a struggle just when it comes to providing safe foods for your family at home. School's about to start.
Yeah.
Mine start tomorrow, yours start next week. So what kind of accommodations are there for kids like yours at schools?
So the school lunch program does provide accommodations for students that have dietary restrictions. You must have the form completed by your physician. So, when you start, right before you start school, you should talk to your nurse. You should try and get accommodations. This can also be wrapped up in what's called a 504. So all of those provide accommodations and documentation of the food allergy and how to keep the child safe at school. And part of it is getting those accommodations in the school lunch program.
Dr. Love, is this a problem that you're seeing among patients, just access to safe, healthy food?
Yeah, absolutely. I think especially after the pandemic, it was very poignant that accessing safe and healthy food was difficult. So we've started screening for food insecurity in the health system. And so many of our chronic conditions are diet treated. So, not only food allergy is the only issue that needs to be taken care of with specific foods.
So are there situations where kids are going hungry or maybe eating foods that they shouldn't just to fill their bellies? That's a problem.
Yes, yeah, absolutely. And I think Emily can definitely, relate to this, where we have some underserved patients in areas that live where there isn't a big box grocery store. There's a convenience store instead, or a bodega, or a quick trip. So it's difficult sometimes to find food that you can eat at those stores, and let alone, alternative plant-based foods that are safe.
Again, taking for granted, we don't realize the access. It's a word that we need to use a lot more often. It's not just having the right health care, but it's having access to it. So what are the common types of food allergies we see? I know Emily mentioned some with her daughters. What else are we missing? And what are some other reactions that kids can get?
Yeah, absolutely. So peanuts and tree nuts, those are some of the most common. In the preschool age, milk, cow's milk is often a very common food allergy. Egg, soy, wheat, fish and shellfish, and then actually sesame. That's a new one that's been around, more predominant in Europe, but definitely a top allergen now in the US.
Did Emily do the right thing by introducing an item? I didn't really think about doing that. I just thought as a mom, I would just be like, okay, I guess we'll find out as we go along who's allergic to what. We were lucky. Emily, not so much. So, but was she smart to go, let's introduce? And when do you introduce?
Yeah, so as she mentioned, the guidelines for food introduction has changed dramatically. It's gone back and forth about when and how to introduce different foods. There's a big push right now to introduce earlier based off of some studies on peanut and development of peanut allergy. So truly, the earlier you can introduce in a person who's especially allergic, if it runs in the family, there's some kind of allergy or asthma or eczema in the family, earlier is better, between 4 to 6 months.
Okay, so should every parent be doing that?
Ideally.
And how do you introduce? Like, really, how do you introduce? Are you letting them touch it, smell it, eat it? What's the safe way to do it?
Yeah, so eating it would be best. And that helps the person develop tolerance to the food by ingesting it and getting it into our stomach.
Small amounts.
Small amounts to start off with.
A year old?
Actually, younger.
Younger,
So,
okay.
if you have allergies or some type of allergic condition that runs in the family, somewhere between 4 to 6 months, once the baby starts to tolerate like fruits and purees and things like that. But for the average family, at least 6 months.
Anybody that should not be trying this at home? I mean, that's so safe for everybody to try to do that. I just want to make sure we're being clear. Any parent with any child around that age is okay to introduce a small amount of peanut butter.
If they've never had a food allergy, I think they're okay to introduce. It's part of the pediatric guidelines. If a parent is very, very concerned, I always tell them that, if you're very nervous because, a cousin or an uncle or something like that has a food allergy, reach out to your pediatrician or reach out to us. We'd be happy to do that first introduction in the clinic.
Why peanut butter? Why does peanut butter get such a bad rap?
It's in a lot of food, and it's an easy, nutritious protein that a lot of schools can have on hand that has a long shelf life. And unfortunately, that was the common, food in the school system for quite a long time.
So Emily, let's talk about this food pantry, because you started the Food Equality Initiative to help families like yours. Part of the initiatives are these safe food pantries. What kind of reaction did you get from these type of very specific safe food pantries?
The reaction was phenomenal. I mean, we garnered excellent support from our healthcare community here, and really worked to make sure that we were meeting not only the specific needs of the patient and their families, but also that we were able to try to give them some choice.
Were you getting reactions from parents like, oh my gosh, where have you been this whole time?
Yes, it is, it was the first in the nation. So it really was not only met a significant need here in Kansas City, but really allowed us to raise consciousness of this issue all across the country. And today, I'm proud to say that the work that Food Equality Initiative started here in Kansas City has really spread and taken off, and we see other organizations across the country working to do similar things.
Well, very well done.
Thank you.
Thank you on behalf of those families. But outside the pantries, you also push for, with the Federal Assistant Program, WIC. Tell people what that is, and did you get a response from them?
Yeah, so WIC is a federal nutrition program specifically designed for women, infants, and children up to age 5. And so WIC, nearly half of all babies in this country are on WIC. It's a nutrition program that really is focused at supporting those who are at risk for malnutrition. And so they review the food package every 10 years. And when I started Food Equality Initiative, we had just entered a review period. And so we were successful in advocating for some changes within the WIC federal nutrition programs. So before our advocacy work began, there was no substitute for fish, no substitute for eggs. So those have now been added to the package. I will say we just completed and got final rule for this last review, which came down in 2024. One of the things that was really important this time was food allergy prevention. So trying to get some of those allergen foods into the infant food package. Unfortunately, we were not successful. We are continuing to kind of look at what the options are to kind of bring that back up during the next review and looking for other opportunities to impact the federal nutrition programs.
You really unearthed a lot of work that needed to be done. Were you surprised that once you kind of started poking around that there was a big need and a lot of work that you were going to have to go after?
Yes, it feels like, I always tell people, it felt like this layered onion. It's like you start fixing one problem and then you realize, wait a minute, there's this problem over here, and then they're all interconnected.
Dr. Love, we hear this phrase, food is medicine. People understanding that nutrition plays this big part in taking care of their health and certainly preventative medicine. But from a food allergy perspective, how do we see food as medicine?
Yeah, and actually I wanted to kind of expand a little bit about what Emily had mentioned. So she mentioned that, peanut is not quite part of the infant food package for WIC right now. And so those patients who rely on WIC to do food introduction, these underserved families that may not have good access to care to begin with, or may live in an area where allergic disease is very prominent, don't have access to do early peanut introduction. So if you think about it, that part alone highlights the importance of food as medicine, because in a person who's highly allergic, atopic, has a family history of some kind of allergic disease like food allergies, and they have poor access to that food, can't even get it on the WIC package because it's not provided, they're probably going to introduce peanut later in life, and they have a higher likelihood of developing a peanut allergy. So that alone shows the importance of food as medicine, and especially food as medicine as prevention of that food allergy.
You teach a class in this, teaching med students. Why hasn't this been taught before?
Well, it has in the setting of nutrition. There's objectives for nutrition that's interspersed within the medical school curriculum, but there's so many things to teach in the medical school curriculum. It's hard to fit everything in. So we've started teaching a set of elective medical student classes, experiences, where the students can firsthand learn how to cook with healthy, fresh produce and make meals that are nutritious and not have to rely on just meat and pasta.
And you're talking about you're talking about students. Med students are not; they're still students. And so to teach them these good habits and how important these healthy foods are, then think about those conversations they can have with patients down the road.
Absolutely, absolutely. And I get the privilege of teaching them the food allergy module, and it's one thing to cook for yourself in the kitchen, but then it's another thing to be cooking for others and you don't know if they have a peanut allergy or a shrimp allergy, etc. I think it took us about 5 classes to actually cook shrimp in the kitchen because we always had a shellfish allergy with one of the students. And so thinking about cross contact and potential exposure, even amongst our own students, was tricky.
Emily, if we say food is medicine, do you believe safe food should be covered by insurance?
I do believe it should be covered by insurance, and we're starting to see that take place now. There's really been this national movement to integrate food and access to healthy food into the healthcare delivery system. And so the work that I do today at Attain is really focused on driving that integration.
So let's talk about this new startup, Attain Health. We called it $1 million idea, but actually it's a $2.1 million idea to be very specific. That's how much money the company raised on its first round of investment. So congrats on that.
Thank you.
What does Attain Health do? How is it helping?
Attain Health has a digital health platform that allows healthcare companies to deliver high quality food and nutrition care benefits to their patients or members. And so what that looks like in practice is we receive referrals from our healthcare partners. Their members or patients are able to then come onto the platform and select the foods that they need and want that meet their dietary requirements. And so we've leveraged filters and tags, and the algorithms that drive that were created by a dietitian, so everything is evidence-based. And so they select those foods, and there's a credit, and as they add those items to the cart, it's a declining balance, and then we deliver those foods direct to their door. So eliminating those challenges of transportation, which can be significant in the populations that we serve. And then we know that access is one component, but as Dr. Love shared, it's really about support and education to really drive health outcomes. So
for the long term.
For the long term, yeah. So we provide content that's focused on nutrition education, disease management, as well as recipes and tips. And then our members can elect to talk to a health coach that really makes it actionable and can really personalize the experience for their specific needs. And they work under the guidance of a registered dietitian. And then obviously in healthcare, it's always about the data, because if we don't measure it, then it does not matter.
I love that. If it's not measured, it didn't happen, it didn't exist.
It didn't exist. And so we support our healthcare partners on that measurement. So providing very rich data and insights back to our healthcare partners on everything from utilization, consumer shopping behavior, so what patients ordered, when they ordered it, as well as insights to their well-being, so that together we can measure and look at improving health outcomes over time, then ultimately return on investment, because we know that we've got to be able to show cost savings or ultimately reduce the total cost of care.
I love what you're saying, though, because it feels like you're putting the power in their hands. It's
Yes.
not just a bag of food. It's not just come and take food and go. It's
Yep.
take the food and then here's what you do with it
Yes.
long term, the big expansion. If you have questions for Emily or Dr. Love, you can ask those questions, or if you want to share your own experience with food allergies, please do. You can use the chat on YouTube or Facebook, or you can email the Medical News Network. Their information is right there on your screen. So Dr. Love, anecdotally, it kind of seems like we're hearing more and more about food allergies. Are we hearing more about them, or are there actually more food allergies? And if so, why?
Yeah, that is the big question. Is it the chicken or the egg? And so, I think partially there is an increasing incidence of food allergies, especially in the U.S. In addition, we're very good about diagnosing it now and recognizing symptoms of food allergies, whereas before, if you talk to perhaps an older generation, they said, well, we just continued eating that food in small amounts. And so things are a little bit different today, where patients and families are a little bit more cautious. You asked me earlier about, what kind of reactions can happen when you have a food allergy. Sometimes the very first reaction may just be a rash, and it might just be a rash on the face, and that could potentially be a sign of a true food allergy. Often the true food allergies have more symptoms: widespread rash, hives, lip swelling, tongue swelling, trouble breathing. In younger kids, they might have drooling as well, or vomiting. So it can become pretty serious very quickly.
Talk about new treatments or therapies for managing food allergies.
Yeah. So it's an exciting time for food allergies. There are definitely treatments in the pipeline that help with desensitization, not necessarily a cure, but would be to help prevent severity of reaction. And there's one called oral immunotherapy that one product has been FDA approved for a few years now, and that can help make the person less reactive to peanut over time, where we give small amounts, very small amounts of peanut protein to them over the course of time. And then more recently, there's a newer medicine, I should say newer indication for medicine that's been around for 10 years. And that one is an injection medicine called omalizumab, and that's very, very exciting for people with food allergies. Basically, it binds your allergy antibody in the blood and kind of sweeps it out and reduces the amount you have. So again, not necessarily a cure, but makes it such that the person is less reactive, less likely to have a severe reaction if they accidentally eat that food.
Emily, I know you advocate for everyone that needs access to safe food, but we know there's a racial disparity when it comes to food allergy and making sure that there is access. Have you personally experienced this disparity? Are we making strides in that area?
You know, I think we're making strides just because there's been such a push to recognize the disparities within the disease, that it doesn't impact everybody the same way, and also who it's impacting. I think even 5 years ago, we didn't understand truly who bore the burden of allergic disease in this country. And the reality is that Black children are 7% more likely to have a food allergy. And really, I think it's just being aware of those disparities. But it's things like Dr. Love said, it's like if we're unable to provide the things for prevention to underserved populations, that those types of things can widen disparities. I think the work that KU is doing here is really important. This is the only Medicaid, this is the only allergy clinic that accepts Medicaid on this side of the state line. So I think access to care is a critical burden, and sometimes it can take months to get into clinic. And so I think, you know, there's always things that we can do to improve that access, but I think the first step is always acknowledging that it affects different populations differently.
I want to get to some viewer questions because we've got some really good ones coming in. And speaking of the burden, Jeremy is kind of screaming at the top of his lungs this morning because he says, what kind of groups work with you when you say healthcare partners? That's one question. Very much wanting to find out how he can help. He says, we need this in Wichita so bad. Emily called you out by name. So what steps should someone like me take to help get these food pantries in their specific community? Start with that question.
Yeah, so I think the first thing, I'm always open to having a conversation, meeting with the clinic and trying to see if there's some local partners that could work with our organization here to provide access or at least build that. We're starting to see many clinics actually put pantries within the healthcare system, and so open to having a conversation to see how we can work together. And Attain, just to be clear, works with healthcare partners. When I say healthcare partners, I mean both health systems and providers and health plans.
So if someone's sitting at home watching and says, I just want to help, I feel helpless, and I want to pick up a phone and call someone, where should they start?
So where they should start first is really just kind of in your local community, understanding what resources are there. Both United Way 211 has a great directory of resources in our community, and I do know that Food Equality Initiative is listed there, and patients here in Kansas and Missouri can get access to support there.
Question from Pat. Can food sensitivities be tested accurately like a food allergy?
Yeah, so it's not clear what IgG food testing clinically is correlated with. And so if you go and see a board certified allergist, especially one that is particularly trained in food allergy. There is some caveats to IgG testing, and we typically don't do IgG testing. We do IgE, or excellent, E for excellent, which is specifically the allergy antibody. That being said, I do see quite a few patients with food intolerance or food sensitivities, and I help them navigate that. I feel that it's so important to help the patient kind of navigate their diet and what works, what doesn't work. So I won't discount what they're having, and I definitely want to make sure they have access to food that doesn't make them feel terrible all the time. So we work through that.
Couple more quick questions. Logan wants to know, if I'm allergic to egg, would that make me sensitive to chicken?
Actually, no. So the egg, what you're allergic to is the egg white protein, and then the chicken protein looks different. So you should be okay.
Jill has a question about, we were talking about the peanut butter and testing. I knew that would get people's attention.
Yes.
So just be clear about, if you're wanting to test your infant, what is a good amount to start with and what age?
Yeah, so if they don't have any allergic history in the family, first and foremost, double check with your pediatrician. Make sure that the infant is able to swallow that type of texture. But the healthychildren.org, which is an educational website from the American Academy of Pediatrics, has some really great tips on there. But I like to take about a teaspoon to 2 teaspoons of peanut butter, warm it up and thin it out, and then I mix it in with a fruit puree that the patient has already tolerated, like applesauce. And I give a small amount, wait about 10 minutes, make sure they're doing fine, give a little bit more, and then I do it first thing in the morning when you don't have anything else to do that day, so that you can monitor and make sure that there's no rashes or anything that develops. Many times, I want to clarify, many times people will say, well, the child got rash on their face. Peanut butter itself can be very irritating to the skin. So if your son or daughter has sensitive skin, put Vaseline around it before you introduce a new food. And that way they won't get what we call an irritant dermatitis. And actually that would benefit them too if they're a little bit more prone to develop food allergies, because you want that allergenic protein, that food allergen, to be ingested first. To develop tolerance.
What's the big takeaway from our conversation today, Dr. Love?
Yeah, I think the most important thing is recognizing nutrition as an important part of our health, and recognizing that food insecurity is a real, global health problem. So utilizing the resources, but most and foremost having our physicians, our nursing, our healthcare staff, even the schools ask, are you experiencing this? If you are experiencing this, these are the resources that you can have.
Emily, before we get to your takeaway, what's the big message to parents to share with their children as they head back to school this week and next week about acceptance of kids in school with different needs when it comes to foods?
Yeah, I think it's important to just create a culture of acceptance and tolerance. We're all different. So my kids have food allergies, but their classmates may have other health needs or other differences. And so I think it's important to note that particularly for food allergy, it's a condition that really needs the support of others to help keep them safe. And so my kids are, they're their own little advocates, and they've got a great circle of friends who understand. I think also it's important to note that it's very common. So I think it's like the statistic is 2 in every classroom, and my kids definitely see that within their friend groups.
I bet
And
they're little educators and share lots of good information.
Yes,
So, well,
yeah.
good. I just want to make sure that kids feel empowered to talk about it, so that we've got enough going on with the bullying. So we don't need to bring in food allergies for that as well. What else do you want us to know before we head out today?
Yeah, I think it's important to note just for physicians and healthcare professionals to understand that, as Dr. Love said, food insecurity is real and it does have a significant impact on health. And sometimes it's not that patients are unwilling to comply, it's they just don't have the resources. So I think creating a culture that's understanding and then also recognizes that so much of what drives our health outcomes takes place outside the clinic. So just being aware of those environmental factors that are impacting your patients and then looking for those resources.
Please do not stop what you're doing. Keep up the great work. We appreciate you and also sharing your story with you and your daughters. Dr. Love, always good to have you. Thank you so much.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.